Okay, so we are live now. I think we should start. Assalamu alaikum, everyone. Myself, Dr. Numan. I'm working as a medical advisor at Getz Pharma, and today we are here to attend a discussion based on recently published guidelines from the SOGP. We'll be having a live session here. We have a panel of experts with us from the SOGP. Let me introduce all of them one by one. With us, we have today Dr. Saida Batul. He's head of Department Obs and Gynae in PIMS Hospital. Along with her, we also have Dr. Sadia Hasanpal. She's working as a consultant and medical director for Concept and Fertility Center in Karachi. We have Professor Dr. Shahid Irshad Rao as well. He's head of Department Obs and Gynae Unit 3 at Minister Medical Hospital, Multan. And lastly, we have Professor Dr. Halima Yasmin as well. She is head of Department JPMC. These all are members of SOGP, and what we will be doing in today's session, we will be discussing the recently published guidelines for pregnant women, how to manage a pregnant woman with COVID-19. We have some other issues as well that are related to the woman health. So I think we shall start just to develop a preamble. Recently, we have seen a very high peak in the numbers of incidents of COVID-19 in Pakistan. Most probably that is due to that we have increased the capacity of our testing. So we are still going up on the curve that we just tried our best by locking down ourselves that we can flatten that, but unfortunately that's not happening. So in certain scenario, if we talk about the women's health, especially the pregnant women, it's such an area which I think might be neglected in that. So we'll be giving a basic overview of the guideline, discussing with the experts that what and how should the care be given to the pregnant woman. So initially, I will ask Dr. Halima Yasmin to answer my first question. And the first question that I have to ask is regarding the impact of COVID-19 on women's health in current scenario. Do you think it has a high risk factor for a pregnant woman to have that virus? And are there any reported cases in Pakistan till date?
Thank you very much, Dr. Noman. Assalamu alaikum, everyone. Let me first of all be grateful to Getz Pharmaceutical for having this forum arranged, and to SOGP especially. The National Society has taken the lead in this situation, which is a healthcare crisis, and all of us needed to sit together. And I'm really grateful to the academic board, especially Dr. Sadia Hasan, for drafting these guidelines for SOGP. Coming back to your question, Dr. Noman, as you said that pregnant women are at increased risk. Pregnant women are at the same risk like general population to contract this infection. But God forbid if it happens and she gets it, then the body's immune system has been altered during pregnancy. So the symptomatology might be more severe, which is obvious from the immune system, which is altered. Otherwise, overall, talking about the rate of infection and the risk, whether it is higher, it is almost the same like general population. But if we look at the statistics coming over nationally and locally, the women are far lesser as compared to males in our society who are affected. Overall, it's hardly 20% world over, 20 to 27%. And nationwide, it is even lesser. I have been texting people since morning, and I found anywhere in Pakistan. Only one case which is reported is of a gynecologist recently in Hyderabad. She has turned out to be positive, and she is currently in her initial first trimester. Let's hope she gets better. She is improving, I've heard. Otherwise, we have not got any positive case from any center.
So if I may ask, what will be the sign and symptoms in such patients? Will they be different in different trimester? Which woman will be at more risk? Is it the woman who is in her third trimester, or the woman in the first trimester, for whose it will be more?
There are incidences, there are reports that when any viral infection occurs in third trimester, it is likely to be more severe. And recently there has been reports where a woman was admitted to a high dependency and then intensive care unit where she underwent a cesarean delivery and a stillbirth. She was given extracorporeal oxygen. Later on, she recovered. Up till now, in the current situation, there has been no reported death in a pregnant female, which is reassuring, I guess. but the symptomatology concerned is almost the same.
Okay.
80-85% would be almost asymptomatic or very mild symptoms. Moderate symptoms in 6 to 10% or 14% cases would have moderate symptoms of breathlessness, body aches, fatigue, even diarrhea, nausea, and a lot of breathlessness. And 4 to 5% would be critical or very severe illness, where it would be needing a respiratory support or where multi-organ failure can occur.
Okay, so my next question would be, are there any evidences of vertical transmission?
Up till now, the 26-27 case series which was published in China, it has been showing that there is no risk of vertical transmission. Vertical transmission means the transmission from mother to her baby during delivery or during pregnancy. It was reported up till now that there has been no risk of having a vertical transmission. And it was very reassuring, but suddenly on 26th or 27th March, a case report has come up which has shown that in a COVID-19 positive mother, the neonate tested positive with IgM. And IgM is a bigger antibody which does not cross placenta. And if it was detected in the neonate, it means that it was due to the immunogenic reaction which was transmitted by the virus from the mother to the baby. But there has been no reports telling that the baby developed severe symptoms, or it was just IgM detected in the serum of the baby.
Moving forward, if
That
we
is
look
one
at the,
case report. Majority of the cases were showing that there is no vertical transmission.
okay, that's good to know. Moving forward, if we talk about the current situation, we are actually in a lockdown. So, what's your opinion regarding the access of pregnant women to the antenatal or postnatal services? Are they coming to your clinics? They are doing their regular visits, or what's the scenario right now?
It is a condition, it is a pandemic which is affecting everyone. The whole social setup of a lot of nations have changed. And coming back to a very sensitive strata of your society, which is women, and out of them, the reproductive age and the pregnant women, we must consider that obviously they will be affected. But as we know, the antenatal intrapartum services, these are essential services. We have to run these continuously, even during this health related crisis. And women should be advised to attend the routine antenatal care unless they are uh, facing a self isolation due to they being exposed to a family member or she herself being symptomatic. In that situation, all healthcare facilities are directed or are requested to mm, to make it possible to adopt to teleconferencing or teleclinics for their public. But overall, I understand the women which we cater to are not used to these technical things. Even we find it difficult to conduct these meetings and these conferences. But somehow, this is a silver line. This is an opportunity which we can explore in our nation, and we can tap this opportunity, and we can see that teleconferencing is definitely a possibility. A lot of clinics have started, like Dow University, Janaat Singh University, Multan, Nishtar University, Fatma Jinnah University, and PIMS. I've heard a lot of people have started the telemedicine clinics, and they are working well. I understand doing a clinical examination on a telemedicine clinic is not possible. And if you think that it is needed, then that woman can be called to the clinic. And if she is a symptomatic woman, she needs to notify to her health facility before coming. And the health facility should be really well prepared. And if she is being transferred in an ambulance, the call taker of the ambulance, the transport staff of the ambulance should also be notified that the woman is either suspected of or is positive for COVID-19 so that they can also apply personal protective equipment and take proper universal precautions.
I
Uh,
totally agree with you. I think being a, please continue.
but then our emergency visit, am I clear, Numan? Am I being listened?
Yes, yes, you are very much clear. I would agree
This
with
is
you. I think being a
an
developing country,
emergency
it's
situation.
quite
Well, it's an
challenging for us to manage online clinics, but still we are trying our best and let's see how it turns out. Anything
I think
further you
it's
want to
going to
add?
be a possibility very soon. And we need to work on that. We were all also not prepared for all this. It just happened. The educational institutes just got closed. The online classes, they just started. I understand we are slightly in the primitive age for that. We don't have those processes or those procedures already lined up in our institutes, but we can come up with newer ideas. And people are coming up, which is very, very encouraging.
Sure, sure. I think that thing actually requires the collaboration of different sectors, which also include the pharmaceuticals. That we should collaborate with doctors and somehow provide some online services to the patient, so they can manage their health and related issues as well. And thank you so much, Dr. Halima Yasmin, for sharing your experience and your opinion regarding these things. Now I would like to move towards Dr. Shahid Rao. Uh, Salim sir,
Alaikum Assalam.
can you hear me clearly?
Yes, yes.
Okay, so I have a few questions for you as well. What I want to ask is that what sort of precautions must be adopted by the SCPs when they are providing care to a woman who has been diagnosed as a positive case of COVID-19? How should they manage that?
First of all, Assalamu alaikum to everybody. And thank you very much, Guests Pharmaceutical, for arranging such a nice activity for pregnant women and generally women concerned regarding the COVID-19. Now, before proceeding for the methods, I think we should just review again the how this COVID-19 spreads.
Right.
So one method is, we all know, is the droplet infection. So if somebody is affected and he or she is coughing, sneezing, or talking loudly, so those droplets containing the microorganism, they travel about 1 meter. So that droplet, if come in contact with the conjunctiva or nasal mucosa or oral mucosa, and that will affect the person. The second way of transmission is that droplet settle down over certain surfaces, and from that surface it touches to the hands, and then from those hands it is transferred to another person. So these are the two ways how this COVID-19 is spreading. Now, if we are talking of general care, so hand washing, no doubt, is very important. Distancing is very important. Isolation is important. Now, your question is regarding the health personnel providing services to confirmed or suspected COVID patients. Now, these patients who are confirmed or suspected, definitely they will come to the labor wards or maternity wards. So there should be some SOPs, guidelines for those. Now the slide, I think this slide is visible to everyone. This is showing the 5 moments for hand hygiene. Before touching a patient, before cleaning or the procedure, after touching the patient. This is again very important. These two, before and after. Now, how to provide the hand hygiene? Again, this is very important question. Hand washing with the soap and water is the best choice than the sanitizers. If the soap and water is not available, then we should go for the sanitizer. And sanitizer should be the alcohol containing sanitizer, and it should be 65% alcohol in that sanitizer. So if we are using that sanitizer in 65% of alcohol containing, or we are using hands with washing hands with the soap, proper hand washing with the soap, then it is useful. So hand hygiene is very, very important, not only for the healthcare providers, for general population.
Agree.
Now, the PPEs which are important in that area where patients are coming, I think you have a slide for PPEs as well. No, next one. Yeah. Now, if you're looking at this slide, there are 2 groups of the patients. One is the general contact with confirmed or possible patients, and second area where chances of aerosol procedures. Now, if we look at the first group where non-aerosol procedures are, that is the routine labor room activities are going on, or we are doing the general OPD. So the recommendations are that healthcare providers should use disposable surgical mask, disposable surgical cap, disposable latex gloves, then a uniform kit, and then over that there should be an apron. And they must be using goggles if they are dealing with the suspected or confirmed patient. But the area where aerosols or procedures are performed, like if we are dealing with the delivery, we are dealing with these surgical procedures, or where like intubation, extubations are going on, then there should be more PPEs are required. Now, starting from top to bottom, again, we should use a disposable surgical cap. Then mask. Mask should be N95, ideally N95 or FFP3 mask should be used in that particular area. And if that COVID confirmed patient is going to be operated, then it is better to have a face shield as well. Then proper protective kit should be wear by the healthcare providers, not only the apron. Then surgical gloves, disposable surgical gloves should be used. So these are the minimum PPEs used by the healthcare providers.
Okay, so if I may ask that, what are the procedures that where you can say the HCP could be at more risk of having exposure? Basically, I want to ask the aerosol generating procedures. What are those procedures? Can you highlight few of them?
Yes, as I've told, the procedures can be, if we start from the screening camp where diagnostics tests are being performed, the persons who are taking the samples from the oropharynx or nasopharynx, they are at highest risk for that. Number one. Number two, the anesthetist doing intubation or extubation or doing open suctioning of the patient. Similarly, pulmonologists doing the bronchoscopies or tracheostomies performed by the surgeons or ENT specialists. Similarly, the persons who are working in the ICU areas or gynecologists performing surgeries in the theaters. So these are the important areas where the chances of aerosol generations are more.
Any special instructions that you want to share with the HCPs for preoperative preparation in such cases?
Yeah, I think we should start it from ideally every maternity services should have a counter, screening counter, just at the reception of that area, as we have in Mr. Medical University. At the reception of the our labor room facilities, we have a corona screening center. Corona screening center. Can you hear me?
Yes, yes, sir. We can hear you. Yes, sir.
We have a
can hear you.
screening center, and doctors sitting there, they have properly equipped, having a N95 mask and whole kit. They first of all evaluate the patient, take the history regarding the suspicion of the corona. If they have some suspicion of corona, then they immediately involve the infectious disease personnel in that room. And if again that team is also suspicious about corona, then that patient is admitted in the labor ward, but we have an isolated area for those patients. So patient was admitted in that isolated area. Now that isolated area, we have a dedicated doctor, staff nurse, and the paramedics. All of those are wearing proper kits and having the goggles and the N95 masks and gloves. Now, once that patient enters there, that was evaluated by obstetrician, and if she is in labor or if she is required some obstetric and cesarean section, accordingly, maternal and fetal monitoring was performed, and the person of the infectious diseases gave her suggestions regarding her management, a test for corona was sent from there. And as we know, the result of this corona takes time. So suspected patient was considered to be COVID-19 up till that time. And we do proper monitoring as routine for normal labor. But if the plan is cesarean, now mode of delivery is not affected by the coronavirus. If some obstetrical indication for cesarean is decided, then that patient is shifted to specific theater made for the patients of COVID-19. Now, before that, anesthetist is informed, the neonatologist is informed that we are planning for a cesarean of patient who is suspected COVID. A test is sent but still not available, so that they can manage everything according to that, and they come with all PPEs prepared for the cesarean section. And regarding the theater staff, we usually try minimize the theater staff, and if general anesthesia is required for that particular patient, then the SOPs made are that anesthetist with the assistant, they enter the theater first, they under the patient, then the scrub nurse enter there, and that after scrubbing, the surgeon will come there, and baby was sent out to the neonatologist. So this is basically the SOPs which are made here for the suspected COVID patient or confirmed. Up till now, alhamdulillah, we don't have any confirmed patient here in Nishtar.
That's a good news actually to know. And let's hope it remains the same way. We have few questions from the audience coming as well. So we have a question regarding that. What's about covering of hairs? How ideally they should be covered?
Yeah, ideally, so hair should be cast back. Then there should be a surgical cap, and hair should be in that cap, and over that is the surgical kit.
Okay. And regarding the mask, there's quite a big debate actually about the mask.
Yeah, big debate. N95, surgical mask,
Any
or
special
FFP3
techniques
mask.
for surgical mask? Because while I was searching through the internet, I find out that there are
Recommendation,
issues related to the air sealing of those masks.
if we are dealing COVID positive patient, ideally it should be N95, at least N95 mask. And if the shield is available during the surgery, that is also important.
Okay, I agree.
But
I think
the important thing is the availability of N95 masks, and whether it is for single use or not. Ideally, it is for single use, but due to shortage of N95, we are reusing it, and there are different ways to reuse it. Either take 2 or 3 masks and use one on one day, second, other, third on the third day, and then again number one. Or you can use a sanitizer, dry it, and then keep it wrap it in some paper and reuse it again on the next duty.
okay.
As far as the cloth making mask, they are not recommended.
Okay, that's good info. Thank you so much, Dr. Shahid. Very nice information that you shared and shared with us. I'll be now moving towards Dr. Saida Batul. Welcome on board, ma'am. How are you?
Thank you, Ji. Assalamu alaikum.
Walaikum salam. Ma'am, I have a few questions related to you, which are women who are being diagnosed as positive COVID and they are getting admitted in hospital. So what's your advice how HCP should manage those patients in hospital setup?
There are basically two scenarios. One is a patient that is admitted routinely, and after a couple of days, she starts developing symptoms which may be suggestive of COVID. This is a one particular situation. And as has been already said, it is the fever, the respiratory symptoms, aches and pains, and cough that sort of makes you worried that maybe she's developing COVID, and she was admitted asymptomatic, but we all know that the incubation period is between 1 to 14 days. But usually it's about 5 to 6 days. So there is a scenario where you admit an asymptomatic patient and then she starts developing symptoms and you're not too sure, and the fever is somewhere, around 100 degrees Fahrenheit. And that is when you start that protocol, and you should have an SOP what to do. And that SOP is basically that you move that patient into an isolation area, and you inform your obstetrician as well as infection control person and organize a COVID test for her, a swab, a PCR that has to be done. And you treat her as a possible COVID, a suspected corona patient. This is one scenario. The other scenario is that a patient comes in with respiratory symptoms, with fever, with cough, and this may be a plain flu patient. And in Islamabad, in this season, you have so much of pollen allergy. And then there is that confusion. And so that is something you have to put the picture together. Is she feverish, or is she a chronic asthmatic for the past 6 months? So a good history taking is necessary, but index of suspicion has to be high. And the moment you suspect that this is corona because of a combination of fever, cough, and respiratory symptoms, along with aches and pains, and obviously a history of contact, which previously was much more common with a person who's been to pilgrimage, which may be pilgrimage of Makkah or Ziyarat, or perhaps the Tablighi Jamaat that has recently, we had an Ijtima. So there are certain highlights which in different areas, we have certain localities in Islamabad, we had some positive cases. So once that is activated, you should have an isolation area where you take the patient. And the first thing you have to do, your patient, jisko wherever you suspect that she has COVID, immediately put a mask on her. So she is infective. So whatever surgical mask that we are using, we don't get N95 routinely. So that patient, the nurse can immediately give her an N95 mask and move her to isolation. And all the staff who then look after her in the isolation, a limited staff, should use personal protective equipment that has been very nicely explained by Dr. Shahid Rao.
Okay. And what's your advice regarding the postnatal care? If I talk about once the baby has been delivered, and what if in case mother was positive for COVID-19? So what should be done afterwards? Should they be kept separated, or how should actually patient be counseled about this, because it's quite a sensitive matter?
Absolutely. I think it is very important that we all, in this group of people who are talking today, we are all working in government tertiary hospitals or in a private referral level hospital. And we should have an isolation area where that woman delivers. She wears a mask and the rest of the team wears the PPE. And the team should include an obstetrician and a nurse, and obviously a healthcare support worker who's responsible for cleaning, as well as a pediatrician. So once the baby is delivered, as Dr. Halima said earlier, vertical transmission is very uncommon. So we have to give that baby a standard care. We should do delayed cord clamping. If the mother doesn't have active cough or anything, that baby should have delayed cord clamping. And then the mother should breastfeed. Majority of patients we have are suspected corona. We have 3-4 admissions of suspected corona, and they all came back as negative. So there is no role, even in a COVID-19 positive patient, to separate the baby and mother in a country like ours. So we need to make sure that the woman wears a mask, she washes her hand repeatedly, and she breastfeeds her baby. And that is the best chance that baby has. But for the next 14 days, the first 14 days of the baby's life, she should take standard precautions. Wash her hands repeatedly. Whenever she breastfeeds, she has a mask on, and that is the way to do it. In countries like China, they have even separated mother and baby. But with our health system, with our neonatal mortality, with our limited resources, best thing which is being recommended by WHO, which is recommended by SOGP, the mother should have the baby with her and she should breastfeed the baby.
It can be done with by taking all the precautionary measures that's required. and isolation is the best that could be done and must be done in our setups. Dr. Saida, can you still hear us?
Yes, please.
Anything further that you want to talk about, or anything that I have missed and you
Yes, I
think
think
it
it's a
should be?
very important point that we need to talk about, and that is, how do you manage these women during labor?
Right.
It is extremely important. They should be managed as a routine patient as far as their obstetric care is concerned. It is the infection prevention which is the highlight here, to prevent the transmission of infection to the healthcare professionals. That is the primary point. The woman, as I said earlier, the moment she enters a facility and you suspect corona, she should be made to wear a surgical mask, and the staff looking after should have their PPE and look after the patient in an isolation area. So this is the first point that needs to be, and we have to make sure that only essential staff should enter the room and visitors should not be allowed, and we should try to do that and remove all non-essential items from the room. If we need to, in our limited facilities, we generally use either Doppler fetal heart monitoring, because if we have CTGs or ultrasounds moved into this area, we have a major issue. So we need to be very clear how to monitor these women. They need one-to-one care. They are more likely to have complications because they are sick. Women with fever, women with pneumonia, they are likely to have more complications, more need of cesarean section. So we really need to be sure, and we really need to give them best of care to prevent them from any complications due to pregnancy. And I think very important, they should not feel isolated, because there is in our culture somehow, when they know that somebody is suspecting corona, the woman gets very upset, the relatives get even more upset. Somehow we feel as if it is we are dirty, or we have something that people are discriminating against us. So we as healthcare professionals have to ensure safety for the healthcare professionals, and ensure that the patient doesn't feel जो हमारी एक टर्म होती है ना, चूत की बीमारी है, मेरे करीब कोई नहीं आता, nobody wants to come near me, nobody wants to touch me. We will touch her, but we'll touch her with gloves on. We will take standard precautions. So these are very important things, and we have to be very careful, and we have to give the message to women that if you are pregnant, you have respiratory symptoms, unless they're life-threatening, please stay at home and self-isolate. Do not come for trivial problems to hospitals, because you may carry this infection to so many more women, and you may cause harm to people other than yourself. But if you need care, the hospitals are ready to give you care. Do not come for trivial problems, especially if you are in this current scenario.
So what's your advice to those pregnant women who are not having any kind of symptoms, but they have their visits that been appointed already? So should they be coming to the hospital, or what should they do?
Most of the government hospitals have closed their outpatients department. And the reason for that is that our OPDs are extremely busy and there's no social distancing. So we are providing emergency services. We are providing delivery and cesarean sections. So women who have low risk pregnancy, they have no urgent need to be looked after or have any urgent ultrasound, routine ultrasounds, routine visits. They should be delayed till this crisis is over to the main extent. I really don't know how long this crisis will last, but till things become clear, if the woman is asymptomatic, she doesn't have any major problem, she should delay her regular follow-up visit. And if there is some telephone conversation possible with a healthcare provider, if there's a telephone service available, they should ring up to satisfy themselves, and they should really avoid visiting hospitals, because hospitals can cause you to catch infections as well.
I think in current scenario where we are talking about the psychological impact of the disease as well, there we need to consult the husband as well regarding the situation, and how should be things approached in that case. That's another important aspect.
Exactly. It's the whole family. In our setup, it is not just the husband alone. It is the mother-in-law, the extended family. And I have yet to see a woman who comes alone. She comes with a whole van load of relatives, her sister-in-law and her sister-in-law's children. The whole team comes in. So this seminar should give them the message, please, you should not bring more than one attendant into the hospital. No matter whether you're corona positive, corona negative, or something, please get out of this habit of, the whole team moving with the woman only, and the old and the frail, the mother-in-law's mother also would like to come in. So we have a culture where we like to support each other. But in the current scenario, we have to desist from this behavior and limit ourselves to one relative who should accompany the woman and no more.
Thank you so much, Dr. Saida, for sharing quite a good knowledge and guiding the patient actually what should be doing right now in this situation. Thank you so much. I'll be coming to a few general questions in the end of the session, but before that, I will be moving towards Dr. Sadia Hassan. Ma'am, how are you? Okay. Can you hear me now?
I can hear you. Assalamu alaikum, everybody.
Ma'am, thank you for joining us for this session. Actually, you are the main person behind this who suggested that we should be doing this. We should be talking about the guidelines that already has been published and how SCP should implement those and what they can do, learning from those guidelines. My first question from you would be, as Dr. Saida also commented on breastfeeding. What's your opinion on that? Should a patient, a pregnant patient who's COVID positive, should continue the breastfeeding, or it should be stopped, or what else could be done in that?
Yes, I agree with whatever Dr. Batul has said. It's very much in line with current evidence. So I will not elaborate further on that. And I want to clarify one thing, that I'm not alone in this guideline. My colleagues who are here at the moment, they have their input, and senior colleagues from all over Pakistan. We have an academic board which has also reviewed this guideline, and our president, Professor Razia Kurejo, she's the one who gave Halima and myself the go-ahead that we must do this very quickly. So I must acknowledge them, and I must acknowledge people like Dr. Batul and Dr. Shahid, who at such short notice have come on. So I'll just add to what Dr. Batul said about breastfeeding, is that I don't know if she said that, maybe she did, that if a woman is breastfeeding, apart from keeping washing hands, etc., she must wear a surgical mask as well. Maybe I missed that hearing from you. So that is something that is necessary, that she should be not, when she's talking, aerosolizing the virus, and that may infect the baby. So that's one thing. And only in today's newspaper, I saw a report where from Romania, I think 10 babies postnatally were found to be COVID positive. So they got the infection after birth, and it is assumed that from healthcare staff. So we have to be very, very careful here. I mean, this is these guidelines that we are making are evolving as new evidence comes in. Pakistan se bhi Dr. Halima ne bhi share kiya, Dr. Shahid ne bhi, or Dr. Batul ne bhi, and a colleague of mine shared from Gujarat, Dr. Shahida, that they had a very suspicious case, and they did 2 tests before delivery, and after delivery they were negative, and the third test eventually turned out to be COVID positive. So we're in a place where test kits are short, and on suspicion we would, as clinicians, all of us would like to test more, and Dr. Halima is also dealing with such cases, and so perhaps later on we could test the antibodies in such patients where the clinical suspicion is so great. So that is something which I wanted to share. Yes.
Moving forward, I want to know what will be your advice to the HCPs when some young couples or newly married couples are coming to them and they want to plan a baby right now? So how should they be planning, or should they be going for the contraception, or what's your advice?
They should not be planning at all. This is a very bad time to even think about getting pregnant. And I do infertility as well. And most countries where coronavirus is attacking the infertility, the guideline is that no infertility procedures should be started, and only if they're already started, they may be completed, and the preference is for embryos to be frozen and not transferred. So as far as that is concerned, not a good time to go for any fertility treatment. Yes, contraception is a big issue. Family planning is a big issue because we are overpopulated. और अभी हमारी सारी सर्विसेज में एक sort of breakdown हो रहा है. We are overburdened. We are unable to conduct our outpatient clinics the way they are required to do, and hence हमारी emergencies इतनी heavy हो रही हैं. So contraception with the social distancing and lockdowns, people are confined to their homes, and if they are not going to be able to get contraceptive supplies, this is a huge issue. And कल ही WHO की एक बहुत एक meeting हुई है, webinar, in which this concern was raised, and our problem in Pakistan is that most of our contraceptive supplies, we have the modern contraceptive methods, सभी हैं हमारे पास, लेकिन इनकी supplies अगर वो हो गई तो फिर बहुत problem होगा. Things like IUCDs, which are coming from India, intrauterine devices, then it's going to be a disaster, because here we are promoting postpartum contraception, which is very good. Postpartum IUCD insertion, implant insertion. तो अब हमें फिक्र ये है कि ये supplies short होंगी, and even condoms की supplies short होने का खतरा है. So we in the private sector as well as the government sector, we need to find solutions and perhaps start making these in our own country as well, क्योंकि ये कोई इतनी मुश्किल चीज मुझे नहीं नजर आती. So because एक IUCD अगर आप देखें तो it's a copper टी, देखें एक प्लास्टिक का टी है जिसपे कॉपर वायर डली हुई होती है, and we make far more complicated things like than that in Pakistan. I don't see why we shouldn't be. Some company needs to come forward and start doing this, and we could be exporting it in this time of shortage as well.
I have another question related to this, that what about the IVF technique? What are you suggesting those patients who were already in contact with you, some sort of treatment was given? If I may ask Dr. Saida, I think you can debate on this.
Actually,
Yes, sir.
I already said that you shouldn't be going for IVF treatment at this time.
What about the patient who were already aligned or were visiting?
Yeah, so I said that they should complete the cycle जिनका already है, and embryo transfers वो freeze किए जा सकते हैं, इनको transfer ना करें, and they can be transferred when this crisis is over. So that's a choice we are already giving to our couples, and Batul can elaborate what she's doing.
I totally agree with Sadia, because that is the recommendation. Can you hear me?
Yes, ma'am, we can hear you. Please continue.
Okay. Basically, it is, as far as assisted conception is concerned, it's a global agreement that at this time no cycles should be started, and whatever cycles were started have now been completed, and majority have been moved towards frozen embryo transfers, so that we do not have women who are likely to present with corona also having a very precious and a pregnancy which is conceived through assisted conception. And it is true for natural conceptions as well, because we do not know how this virus works, although there are no reports of any teratogenicity, and apparently it doesn't seem to harm the pregnancy in the first and second trimesters. Apparently even in the third trimester, because woman is going through labor and things, you're a little concerned due to fetal compromise and fever affecting the baby, but it is the worst possible time to get pregnant. So I would advise the young couples and whoever is planning for a pregnancy, delay pregnancy till we are out of this acute crisis, because you are not able to get standard care because the whole system is geared towards COVID crisis.
Thank you, ma'am. Coming back to you, Dr. Sadia. As you said that in current scenario, if we talk about the access of women to health services quite affected. So what's your advice on that? If we talk about the reproductive health, we have some other issues related to the violence against women as well. So what should be done in such cases?
देखिए इसमें टेलीमेडिसिन का काफ़ी अब रोल आ रहा है एंड when you are in this confined situation where you cannot get out of the house, both husband, wife, children and extended family, so people get on each other's nerves and violence ka incidents बढ़ जाता है. This is a known fact. So women, as it is, even when they're not in lockdown, they have a problem in our society getting help. But there are many organizations, NGOs भी हैं और गवर्नमेंट के भी इदारे हैं जहाँ पे उनको हेल्प मिल सकती है. And whoever's in this webinar, I would suggest you contact GETS. We have given them a list of all the organizations with their phone numbers and their websites, which you can access. And in fact, आप अपनी clinics में रखें ये list and have it ready at hand, so that if a woman calls you with a certain problem, it could be someone you know, it could be one of your doctors or nurses, even staff that works for you. You can guide them appropriately regarding medical help, legal help, shelter. ये सब चीजें हैं जो मिल सकती हैं. एक और चीज है emergency contraception. That I mean we are doing this already, that our patients हमें phone पे कर लेते हैं contact, या फिर there are helplines. ग्रीन स्टार की है और भी दूसरी NGOs हैं उनकी हैं, and even psychological support ki helplines hain, which can be accessed and people can call them and get the right advice through without physically having to go anywhere. So emergency contraception to mere ख्याल में हर डॉक्टर को पता होनी चाहिए, not just gynecologists. ये GPs का भी काम है कि emergency contraceptive pills की एक या दो गोलियां होती हैं डिपेंडिंग ऑन द पैकेट, ये लेने से बहुत सारे प्रॉब्लम से वो बच सकती हैं. दूसरा एक और इशू है, बिकॉज ऑफ दिस अनप्लान्ड प्रेगनेंसीज हो सकती हैं और मिस्ड अबॉर्शंस हो सकती हैं, थेरेप्यूटिक अबॉर्शन की जरूरत पड़ सकती है. और ये बहुत बुरा वक्त है जब हम रूटीन क्लिनिक्स नहीं कर रहे हैं, तो दीज वुमेन कैन प्रेजेंट इन इमरजेंसीज विद सिवियर ब्लीडिंग, इनकम्प्लीट अबॉर्शन की वजह से. सो इन केसेस में भी, जैसे डॉक्टर शाहिद ने बताया, डॉक्टर बतूल ने बताया, हम जनरल एनेस्थीसिया को अवॉइड करने की कोशिश करेंगे. हम कोशिश करेंगे कि ये प्रोसीजर थ्रू से मैनुअल वैक्यूम एस्पिरेशन अंडर लोकल एनेस्थीसिया या.
Sorry, I'm interrupting, but that's actually a question that has been asked by someone in the audience as well, that what should be the choice? It should anesthesia में उसमें करना भी चाहिए या नहीं? अगर आप कर रहे हैं तो it should be general or spinal?
No. General anesthesia is to be avoided for all operations, which includes cesarean section that Dr. Shahid said. हम already spinal में कर रहे हैं. पाकिस्तान में ज़्यादातर जगहों पे spinal anesthesia में cesarean भी होता है. So we want to avoid that general anesthesia, because then everyone has to be in PPE. PPE for any procedure, so you don't know if it's COVID positive or negative. You should be in PPE, especially the anesthetist and the surgeon. So, and everyone in the theater. तो आप इसको अवॉइड कर सकते हैं, उसको सेफर कर सकते हैं बाय जस्ट गिविंग एन सक्शन इवैक्यूएशन, जो इनकम्प्लीट अबॉर्शन के लिए हम करते हैं. That is safer than dilatation and curettage. It's gentler and it requires less anesthesia and analgesia. तो प्रिफर्ड हमारा यही है. अगर आपको इससे ज्यादा चाहिए कि लोकल से आपका फायदा नहीं हो रहा, तो आप सेडेशन भी दे सकते हैं और आप अंडर स्पाइनल भी कर सकते हैं. ये सब सेफर है. ट्राई एंड अवॉइड दैट जनरल एनेस्थीसिया. एंड प्लीज डोंट फॉरगेट द मिसोप्रोस्टल. अगर ब्लीडिंग पेशेंट आपके पास आई है तो आप 3 या 4 गोलियां मिसोप्रोस्टल की अगर दे रहे हैं, so that will immediately make the uterus contract and decrease the bleeding while you are getting your preparing her for, say, any procedure like evacuation. So, and she may not need any evacuation, she may not need any surgical procedure if you are using misoprostol, because 95 से 99% तक की complete evacuation हो जाती है, और बहुत कम की फिर DNC या वैक्यूम सक्शन इवैक्यूएशन करने की जरूरत पड़ती है. तो it's safer to use the medicines rather than surgical procedures. And if you are doing a surgical procedure, try and do it under a local anesthetic.
Dr. Halima, can you share your opinion as well? You agree completely with Dr. Sadia Hassan? Any other thing that you would like to add in this thing?
Thank you very much for asking my opinion. I completely endorse what Dr. Sadia says. We usually try to use local and regional anesthesia in most of the obstetric and gynecological procedures, but rarely, if needed, general anesthesia is required. Like we did a case today, she was extremely thrombocytopenic. We had to resort to general anesthesia, but at that time we obviously followed all the personal protective equipment. The anesthetist wore a shield, and we even put up a head box on the top of patient's head where there are 2 holes, and they put the hands in and then intubate the patient. It's a bigger head box like we put on the neonates in nurseries if needed. But usually we try to avoid general anesthesia because it will create a lot of aerosol. The patient might cough, the patient might gag, and the anesthetist and the anesthesia technician would be at high risk. So if we can general anesthesia.
Thank you, ma'am. As we are talking regarding the contraceptives, Dr. Sadia, I'm coming back to you. I have a big question to ask. In past, we have seen that when such pandemic things have occurred, and even if we talk about the period of after World War II, we have seen a baby boom. So will we be seeing a quarantine baby boom in coming 9 months or maybe an year?
Yes, I'm quite sure this is going to happen, and that's why we all need to be so proactive, both in the private and government sector, and the NGOs as well, where services for contraception should not stop. We should be accessible to our patients on the phone or through teleconference like this, or there are centers which are open. Many organizations like Mary Stokes, Green Star, government के अपने इदारे खुले हुए हैं, and government hospitals जो before women go home after having a baby, they can get their contraception there and then. So these are which we call postpartum contraception, and IUCD or implant, or Dr. Halima recently had a patient who wanted an implant, and they'd run out of implants, and they got them through the government. They contacted the right people, and it happened within 15 minutes, right, Halima? So it's where there's a will, there's a way. So we have to make the effort to find the choice of contraceptive the woman wants, and if we don't have that supply, give her another alternative choice कि आप ये भी कर सकती हैं. The last thing you want is an unplanned pregnancy. And
I must agree with Dr. Sadia, that couple, they needed to wait 2 extra hours in this situation, but they really waited. She was a case of identiform mole who was evacuated. She was desperate because this was her 3rd molar pregnancy. So the couple waited. वो बेचारे बैठे रहे the time. I'm thankful to the people who helped me, and thank you for acknowledging that incidents.
Yeah,
Very,
and
very years away. We must
yes.
work on that.
Yes, and I feel that we have these very nice WhatsApp groups. Both SOGP has, and we have one with family planning organizations and the government. And I feel that we've all come together at this time, and it's really nice to see that we're all trying to help each other. Where one doesn't have one thing, to kisi aur ke paas hai, they are offering. So we're very happy to give advice, to give supplies, whatever we have. And I've personally had several phone calls regarding emergency contraception and this worry that my contraceptive supply is running out. What should I do? So we all must know कि कहाँ पे हम इनको direct कर सकते हैं.
Okay, another question from you, Dr. Sadia. We know that private sector is already doing a much, and they already have done. But probably there might be few gap areas, things that could be improved. So any suggestions regarding that on what we need to focus more right now?
You mean the private sector, not
Yes.
the government? अच्छा देखिए private sector में there is a problem here because not all but some private practitioners do not promote contraception and because they think कि उनका business खराब हो जाएगा, deliveries कम हो जाएंगी, तो maternity home कैसे चलेगा? They need to come out of this thought process. They are doing great damage to the country. We are number, I think, fifth number.
We are
पे हम
number
आ गए.
fifth, right? Number
Yeah,
fifth.
so things are so bad, you can see, and we have a very poor health system. It is, it's pathetic. It can be improved a lot. अल्लाह करे शायद हम बहुत सारे lessons learn करें इस crisis के बाद और हमारा health budget भी बढ़ जाए. So that will greatly help. But private practitioners, all practitioners, and it's not just gynecologists, need to update themselves on modern contraceptive methods. The modern contraceptives जिसमें जो long term है, LAGs कहलाते हैं, उनमें IUCDs and implants. These are safe. They are very effective, nearly 99% effective, and long term and cheap when you think of it. और अगर आप मुझसे पूछे तो PPIUCD जो कि हम immediately after delivery of baby डाल रहे हैं, वो हमारा एक बहुत बड़ा solution है. तो हमें अपने myths and misconceptions डॉक्टर्स को क्लियर करने की जरूरत है, पब्लिक को क्लियर करने की जरूरत है, और जो हमारे फायदे की चीजें हैं वो अपनाने की जरूरत है. और लेट्स नॉट फॉरगेट कि अगर सपोजिंग ये मेथड अवेलेबल नहीं है तो नेचुरल मेथड्स भी हैं, ठीक है, सेफ डेज मेथड्स भी हैं, उनको मत भूल जाएं. हमें अपने क्लाइंट को सब चीजें बतानी है कि देखिए ये नहीं होगा, पिल्स नहीं मिल रही तो आप ये भी कर सकती हैं, अच्छा वो भी नहीं मिल रहा तो ये भी कर सकती हैं, ठीक है. और आई वुड सजेस्ट डॉक्टर्स अपनी क्लिनिक्स में, अपनी प्राइवेट क्लिनिक्स में भी सप्लाईज रखें. जब आप किसी को कहते हैं कि पिल्स लिखकर देते हैं या कुछ भी लिखकर देते हैं कि आप ले आए, तो आम दिनों में चीजें मुश्किल से मिल रही होती हैं, वो कहीं आजकल तो और मुश्किल है. सो आई वुड सजेस्ट कि जरा थोड़ी सी जुम्बिश करें और अपने पास मंगवा के रख लें कुछ चीजें, सप्लाईज.
Any advice that you would like to give to general practitioners right now?
Are you asking me?
I'm asking Dr. Shahid Rao if he would like to add something.
Yeah.
I think Dr. Satya ने बहुत अच्छा explain किया. General practitioners and family physicians are very important for this family planning and control of this rising population. Basically, the issue is the same. The gynecologist or the private practitioners, they don't have the supplies of contraceptive material with them, and they just prescribe कि आप ये लें, IUCD ले आएं, रखवा लें, take this long-acting contraceptives. Basically, long-acting contraceptives, they are not available on the shops. So ideally, they should be available to the clinics of the gynecologists. So if somebody is willing for that, तो आपके पास वो available हो और आप immediately इसको वो दे सकते हैं.
Great.
I think
Great.
this is
Before we move forward to the audience question, I may request, I have unmuted all you. If we have forgotten something to discuss about कोई ऐसी चीज है which is more important and we haven't discussed till now, so you can discuss, or we should start taking questions from the audience.
Questions ले लें.
Okay. Okay. Regarding questions, the most hot question जो कि सबसे ज़्यादा मुझे दिखा है अभी तक comment section में, that is, what's the treatment options? Can we use HCQ? Any opinion on this from any one of you?
Treatment options for any COVID-19 patient, whether it's a male or female, is the same. आज सुबह ही रिन्यू हुई हैं ट्रीटमेंट गाइडलाइंस, जिसमें जिंक, विटामिन सी और डी भी ऐड हुए हैं. उसके अलावा एंटीवायरल्स हैं प्रॉपर डोजेज में, और क्लोरोक्विन है, हाइड्रोक्सी क्लोरोक्विन है. ये हैं ट्रीटमेंट ऑप्शंस. जो कमेंट सेक्शन में देख रही थी जिसमें आ रहा था prevention is still a controversial issue. Do we need to use preventive therapeutic treatments? It is still, the evidence is awaited. तो इसलिए इस तरह के फोरम से हम कोई भी irresponsible बात कहना नहीं चाहेंगे. I would like कि उसके लिए हमें वेट करना चाहिए एविडेंस का. ट्रीटमेंट के लिए जैसे किसी भी कोविड-19 पेशेंट की ट्रीटमेंट का जो गाइडलाइन है, जिसमें एंटीवायरल्स हैं, हाइड्रोकिनोन, HCQ है, क्लोरोक्विन है, जिंक है, विटामिन सी, डी, ये सारी चीज़ें शामिल हैं. हाइड्रेशन है और नेबुलाइजेशन है, स्टीम है. ये सारी चीज़ें वैसे ही होंगी जैसे किसी भी मरीज के लिए होंगी. लेकिन प्रोफाइलेक्सिस के लिए अभी कुछ भी एविडेंस नहीं है.
Can I make a comment here? Can I make a comment here? I think हमें अपना जो हमारा ये webinar है, this is related to COVID-19 in the pregnant population or in women in the reproductive age. So जो comments हैं HCQ के बारे में या steroids के बारे में या antiviral के बारे में, तो I'm sure जो हमारे infectious diseases के experts हैं, जो कि हमारे focal persons हैं, जो COVID-19 के wards को run कर रहे हैं, I think they are better people to guide. और जो भी हमारी खातून जो हम अभी तक डिस्कस करते रहे हैं, जो प्रेग्नेंट खातून, मेजॉरिटी तो हम सिर्फ सस्पेक्टेड कोरोना की बात कर रहे हैं. अभी तक कंफर्म्ड कोरोना ट्रीटमेंट की हमारा एक्सपीरियंस हुआ ही नहीं है. तो जो भी ट्रीटमेंट होगा पॉलिसी का, वो हमारे इन्फेक्शियस डिजीज एक्सपर्ट्स हमसे डिस्कस करके हमारे साथ चलेंगे. और बड़ी इंपॉर्टेंट चीज़ है कि इट इज़ वेरी इंपॉर्टेंट कि इन पेशेंट्स विद कोरोना, विद कोविड, if they are pregnant, they often need X-ray chest, they need CT of the chest, they need all sorts of investigations जो routine में pregnant women की नहीं कराई जाती. लेकिन guidelines are saying very clearly कि अगर उसको CT chest की जरूरत है, abdominal shielding होनी चाहिए, CT chest हो. X-ray chest की जरूरत है, abdominal shielding होनी चाहिए, X-ray chest होनी चाहिए. And the questions which are being asked related to prophylaxis, that is for people who are looking after COVID patients, women. We fall in that category. We are high risk because we look after these women. So ये सारी चीजें हमारे infectious disease control के experts हमें बेहतर guide कर सकते हैं.
Yes, I would agree with Batul and what Halima has said. हम isolation में इनको manage करें, किसी को भी नहीं चाहिए कि वो खुद से अकेले manage करें इन औरतों को. और
infection control disease team should be involved, and I think they should treat.
Another interesting question that I came across in the comment section is mostly people get confused. They are not able to clear the symptoms of viral with COVID-19, simple viral cold and flu with the COVID-19 symptoms. So somewhere in guidelines and in some documents, it has been mentioned that maybe change in taste or smell could be the first sign of COVID. Is it really the case?
Yes, it's reported, it can be. So since none of us have dealt with such a case yet, I don't think we can comment really. Yes, but it's reported amongst other. There's a rash that is also reported, which can be confused with a measles rash. So that is also, but it's one of the rare ones.
Okay. Another important question, and that's G. Dr. Saida, please.
मैं ये कह रही थी कि जो सस्पेक्टेड कोविड पेशेंट्स हैं, और ये मैं अपने और कॉलीग्स को भी कहना चाहूँगी जो हम भी बैठे हैं, कि जो उनके सैंपल लेने होते हैं सस्पेक्टेड कोविड के पेशेंट्स के, वो भी जो जैसे डॉक्टर शाहिद राव ने कहा था, यू नीड अ प्रॉपर पीपीई in place for the person who's taking the sample. So ये बहुत important है. We should not ask our nurses or our postgraduate residents who do not have PPE to take a sample for COVID. It is for the experts to do that. And in all hospitals, all big hospitals, there is corona testing facility, and there are people who have PPE who are doing that, and they should be called, or the patient, if she's in a stable condition, she can be sent to that center. If she's not stable, then that person has to come and do the sampling. We cannot, because it's the most infectious procedure that can be done by putting your face directly in contact with that woman and into those secretions. So that's very, very important point. And we have to have a continued collaboration with our primary corona screening center, whichever is available in that particular hospital, or if not, then we have to have collaboration with a nearby hospital.
Another important question, and that's regarding, I think it should be done in our routine practices as well, is regarding the disposal of the waste. So someone on the Facebook asked that how we should discard the gloves and masks and the PPE, everything that we have used in such wards. How important it is to properly discard those things as well.
Who's going to answer? Should I answer for that?
If you want to, yes, you can start.
Like any universal precaution, we always need to decontaminate the worn material first. It is recommended that there has to be a proper room outside the positive case room for donning and doffing, which is putting on and putting off the PPE. Once you are putting on, you do hand hygiene, put on the protective equipment. You have seen the patient, you are coming out. First thing to do is hand rub. Decontaminate your gloves and then take out the mask, the cap, the gown in the proper doffing guideline procedure. And that has to be done outside the room. Or if not available, then inside the room. But one thing which should never be taken out inside the room of the patient is the N95 mask or the respirator if you're wearing it. Other things need to be decontaminated first, and they should be properly wasted. The infectious waste guidelines should be followed, and they have to be first chemically decontaminated, then they can be sent for incinerator or for chemical sterilization, whatever is being the practice in that hospital. But there has to be proper infection prevention and waste disposal guidelines in every unit. And we can share them on SOGP website if needed for the people.
I think we have covered. Ji, Dr.
I just want to add that, every unit, every hospital which is dealing with pregnant women, you should also, or any hospital should have a dry run of what to do when such a patient comes, So ये जो डॉक्टर हलीमा कह रही हैं, donning and doffing of the PPE, ये अगर आपने किया होगा तो आप सही करेंगे. So this has to be a class sort of thing undertaken by the hospital managers or senior staff, so that all the staff knows what to do.
I'll just make a point here that we have, because we've had 2 or 3 suspected corona patients, thank God they were all negative. So we have made an SOP for our own hospital. So whatever guidelines are there, everyone has their own limitations in each hospital. There are some physical limitations, there are some financial limitations, there are various limitations. And every hospital has its own system of registration, reporting, emergency, labor room, theater, they're proper. So you have to have an SOP for suspected corona patients who present in a general gynecological obstetric unit. And it is happening, and it will keep happening. So my message to, if we have other gynecologists on this forum, please make an SOP. We've done an SOP today. We've typed it. We have me, myself, the other unit professor, the nurses, and the administrator. We sat down together and we wrote down an SOP. It's a 1.5 pager, but it is very clear. What will the nurse do? Where will the patient go first? Where will she go second? Where will she be taken? Who will take it? How many PPE are required? These are very basic things. And it is by personal experience I'm saying that if you do not have things clarified, you have a lot of unrest in the healthcare workers, because they're all very, very worried and insecure. So it is our responsibilities as team leaders, as obstetricians, to make sure that we have very clear SOPs so that our staff are very clear what are their limits, what is available for them, where to wear PPE, where not to wear PPE, where they're supposed to don, where they're supposed to doff. It is for us, within the limitations of our system and our hospital, to make that SOP. So I'm sure we can all get on it, and tomorrow if somebody else sits down, or maybe day before yesterday if somebody had sat down, we have those SOPs and we should do them.
I think we have now almost covered all the relevant questions from the comment section. We are now, I think, about to close the session. But before that, thank you so much to all of you, to Dr. Halima, Dr. Saida Batul, Dr. Satya Hassan, Dr. Shahid Rao, for taking time out and actually agreeing with us on such urgent basis for this session. Thank you so much. And I hope that ICPs, being the frontline soldiers, will do whatever we can do to provide the protective material, and just jitni knowledge we can spread to all the people, how they can protect and how can they actually come up with something which can actually reduce the number of this disease. जिस तरीके से फैल रही है, I think we need to have more awareness in the public as well, and we need to take some serious steps for the safety of the SCPs. Anything that you would like to comment, please, you can.